Welcome to Business Connections, produced by the Dayton Area Chamber of Commerce. I'm Holly Allen, Director of Marketing and Communications at the Dayton Area Chamber of Commerce. Today's topic is one that gets a lot of attention from business owners, and that's probably because it's a big expense for business owners, but there's also been a lot of confusion surrounding it. We are talking about healthcare today, and I'd like to welcome my guest, Lori Connie. I'm so sorry, Lori. Okay. We've known each other for a few years, and I keep saying her name wrong. She's with Anthem Blue Cross Blue Shield, which is a great chamber partner and helps us help our employers as they look at what to offer as far as health insurance. Thanks for being with me today, Lori.
Thanks for having me.
And I'm sorry about saying your name wrong.
You're not alone.
Okay, at least there's that. Well, I want to jump in because I feel like we can't talk about healthcare and the healthcare landscape without discussing the fact that there has been just a lot of upheaval in the industry over the last few years. Of course, the Affordable Care Act made a lot of changes to the industry, and now that we're under President Trump's leadership, he has talked quite a bit about wanting to overturn the Affordable Care Act, and so things have kind of been on unsteady ground.
Right.
So, Lori, can you give us a little bit of insight about where we stand right now?
Sure. So there has not been a repeal, there has not been a replace. So the Affordable Care Act stands pretty much as it has since 2014. Probably, just a couple things I think that are worth mentioning. The individual mandate, that has been repealed, and that will go into effect in 2019. Mm-hmm. So what does that mean? It's not 2019 yet, so it's hard to know what that means, but I think, one thing to mention, it's open enrollment right now for individual open enrollment, and we've seen that the market has gotten smaller and we've seen enrollments are down. So is that because of the individual mandate? I think more will be assessed as time goes by. Another thing to mention, the short-term health plans, those have been given an extension. They can go as long as 364 days. What does that mean for consumers? I think it means you definitely need to make sure that's the plan for you. Does it offer enough protection? Because it is a short-term plan, it's somewhat of a catastrophic plan. It's not the type of plan you're going to get from your employer. It's not the type of plan you're going to get on the individual exchange. So I think it's something definitely that you want to look at. And then, association health plans. I know there's been a lot of talk about association health plans right now. Anthem in Ohio, we don't have an option that is an association health plan, but there are a lot of conversations about it in Ohio and in our other Anthem states. So I'd say stand by on that topic, more to come. But we'll be talking about some of our other offerings here in a minute. So,
yeah, absolutely. That leads me right into the next question I wanted to ask, because business owners are always looking to offer affordable but good coverage for their employees, and that's one of the things we found at the Chamber. Because the economy is doing so well, our employers are looking for ways to set themselves apart when they are attracting their work staff. So health insurance is important. And one of the things that we have partnered on, the Dayton Area Chamber of Commerce and Anthem Blue Cross Blue Shield, is this program which is called a MIWA. Can you talk a little bit about what the MIWA is and why it might be attractive to employers?
Sure. So the name of the plan is the Aca Benefit Plan. Right. It is a MIWA, and we rolled the plan out in May of 2016. It's a multiple employer welfare arrangement. And, previously, prior to 2016, MIWAs typically were employers in the same industry that would band together to provide health insurance. With this benefit plan, the commonality is that the small group employers are a member of a chamber. Okay. And the Dayton Chamber is, of course, one of our partners with the Aca Benefit Plan. It's a statewide offering, so it allows any small group employer in Ohio that's interested in purchasing the benefit to look at it and to be eligible, as long as they have at least 2 employees and 2 employees on the plan. Okay. And they need to have no more than 50 total employees in a calendar year to be eligible for the plan. But, the plan it's a large self-funded pool. Okay. So it allows employers, again, to band together to have coverage that is medically underwritten. Okay. And in theory, if it's medically underwritten, that allows us to provide a little bit more affordable coverage, because we're able to rate on more than just the age, the area, in just those items. So we're able
Right.
to rate on the risk of the pool. And then the support of the plan, because it's backed by Anthem, it's backed by our stop loss, and it gives them a fuller protection of a larger pool, stable increases, and we bill the employer directly a premium equivalent rate, so it looks and feels like a plan that they've had prior to the ACA.
Okay, so steady increase is something that obviously I think
Right.
employers would be attracted to. Is there a certain demographic of business that it would be probably a great fit for something like the Aca benefit plan?
So generally speaking, it's going to be your younger, healthier groups that have seen the impact of the Affordable Care Act. So those plans that fall under the ACA, those community-rated plans, they're community rated. That means we can't rate on health risk. The Aca benefit plan, the MIWA, allows us to rate on health risk. So if this employer has a young, healthy group of employees, they're going to see more favorable rates, more likely in the MIWA than they would under an ACA plan.
Okay, so it's a good opportunity, and like you said, it's brand new. So if our employers haven't taken a look at it,
Right.
would now be the time?
Now would be the time. I mean, we have, if we look at our book of business in total in Ohio, we have about 17% of our small group employers today in the Aca benefit plan. So that's over 2,000 employers right now are in the plan.
Wow.
This is, of course, our busiest time of year because a lot of employers make benefit decisions for January. So this is a great time for employers to talk to their brokers about what is available in the market and what works best for them.
Speaking of planning for 2019,
Right.
talking to brokers, I think a lot of our business owners now are taking the time to look at, I guess, their full business plan for the upcoming year. And one of the things that we try to tell our employers to consider is the wellness and health of their employees and their workplace, which in turn we know benefits the business as a whole. And I know that there are a lot of things, besides the health coverage you offer at Anthem, to really encourage the overall wellness of a workplace.
Right.
So I know there's a laundry list, but can we talk about, let's start with maybe preventive care.
Sure.
And how Anthem can help in that arena.
Sure. So whether you're talking about, and we didn't really talk about this too much, but we have plans in the small group market, transitional relief plans. So those are plans that were prior to 2014 where employers could keep the plan they have. That's been extended since 2014. In theory, January is the last time for these groups to renew, and the plans should expire at the end of 2019 unless there's another extension. All of those plans have embedded preventive care visits in the plan, which means the plan pays for those visits. So, I think it's really important for employers to hold open enrollment meetings and provide, their benefit summaries or their SBCs to their employees, or have some type of materials, whether it's in their lunchroom or a comment room, that talk about the plan and talk about the benefits that they have. So, if their employees are able to get those preventive care visits covered by the plan, no additional cost to them, that's a perfect way to make sure that they're healthy, they're staying healthy, they're looking for risks, and if they find something, then they can get treated early.
So what would your advice be to employers who are thinking about ways to encourage or to inform their employees that those things are covered? Now's the time to make those appointments and make sure that you are getting checked out.
Right. So again, I think, if you're an employer that has an intranet site and maybe you put materials out there just to inform your employees on anything in the workplace, I think it would be a great idea to have a spot to include information about all of your benefits, whether it's your health benefits, maybe you offer dental, life, vision, disability, something that we offer at Anthem as well. It's a great place to make sure that your folks know where they can go to access that information. I think having, again, those employee meetings during open enrollment is a great time to promote the benefits. And again, if they have a transitional relief plan, an ACA plan, which right now we have about 23% of our employers have ACA plans.
Okay.
And then transitional relief plans, we have still 60% of small group employers at Anthem offer those transitional relief plans.
Okay.
So again, whether it's MIWA, ACA, transitional relief, all of those plans include preventive care.
So transitional relief, those are the employers who have kind of stayed where they were, kind of waiting to see what's happening with the
Right.
ACA, is that right?
That's right. So again, those plans are up for renewal in January. The employers that have determined that that's what they want, they've seen some renewal changes over the years just to fall in line with the rules of transitional relief. And you know, the plans offer they offer great coverage. They have full networks. They have large prescription benefit networks, prescription benefit formularies, which that's the list of pharmacy that are prescriptions that we would cover. So they're the most, I would say, robust plans out in the market. When you look at the ACA plans that we offer, we have the ability to do some things to try to make those plans affordable. We have an HMO under our ACA plans, which helps control cost. It's a smaller network. We have smaller list of prescription drug offerings under our ACA plans. And then with the MIWA, the Aca benefit plan looks very much like our transitional relief plans, which is why, again, those plans have become so popular. Because if 60% of our employers are still on those old plans, that's what they like, that's what they want, that's what they want to offer their employees. So we want to have an offering that looks like that we can continue to sell in the future.
Okay, because the transitional relief, there is a little uncertainty, which each year you kind of wait to see what the government's going to do, if they'll allow them to continue for another year. Right.
So again, as it stands today, those plans will terminate the end of 2019, and that means 60% of our business, Anthem's business in Ohio, will have to make a decision. Where will their next step be? Will they offer a plan through the Aca benefit plan, through the MIWA, that looks and feels very similar to what they have on transitional relief, or would they offer an ACA plan, or would they make another decision?
Yeah. Right. Well, that'll be a big decision for them to make. That comes at the end of 2019.
Right.
Yeah. Well, you did mention some of the ancillary care products out there. You have dental, life, vision, disability.
Right.
Can you talk about why those are important to add to your base health insurance offering within your workplace?
Right. That's a great point. So I'm glad you brought that up. So, you know, our partnership with the Dayton Chamber offers discounts on those programs. So that's something I definitely want to bring up.
We love that you brought that up.
Right. So whether you're on an ACA plan, or you're on a grandmothered plan or a transitional relief plan, you do have the ability to get discounts on those products. And if you have all of your benefits with one carrier like Anthem, all of those claims connect, and we can see, we call it a whole health connection. We can look at the member, and we can look at all of those claims and see if something's happening. So, you know, maybe your member doesn't go and get preventive care services. I don't know why. Maybe they just don't have time. Maybe they don't go, but they wear glasses, so they have to go and get that vision exam. And when they're at their vision exam, the provider sees something that maybe looks like they have high blood pressure, or looks like they have diabetes. That claims information, that will transfer to their primary care physician. And hopefully that conversation with that vision provider will get that member to go get that preventive care check, and then see if there needs to be a next step. Do they need medication? Do they need, you know, additional intervention?
These are the things that we hope our healthcare providers, you know, that these things are happening. So I think that's very important to look at whether you have all of your care through something like an Anthem, so that you know it, rest assured, all of that information is being held in one place, and you're getting a real whole picture of your health. I think that's important to employees to make sure that's happening.
It is.
And there are some other tools. You have kind of a toolkit on your website where people can use.
We do. So if your employer has our Affordable Care Act plan, our ACA plans, or our Aca benefit plan, our MIWA, we have an online wellness toolkit. And it just starts with the member doing a health risk assessment, probably takes 10 minutes. And then based on the results of that assessment, the member can choose maybe a goal. What do they want to do? Do they want to increase their fitness levels and then maybe track their fitness? Do they want to change their diet? Or do they have a chronic condition that they need help with? And we have many different ways to help our members. We have programs that help with disease management, like asthma. We have programs that help with maternity. We have a Future Moms program. So if perhaps a member fills out the risk assessment and at that moment they're pregnant, they can join our Future Moms program, and that'll help them along the way, let them know what to expect as their pregnancy progresses. services. We have a 24/7 nurse line. So if it's late at night and you're not sure what to do, you can call that nurse line and they might give you some advice on, you should definitely go seek services right now, or hey, this sounds like something going on that could wait till the morning.
Yeah.
And then we have another benefit called Life Health Online, and it sounds
which
like
I've used.
Sounds like maybe you've used it before. I know
that with 2 kids. I think that's it's been very helpful to me, I can say.
Right.
So you explain what that is.
Sure. It's an online benefit, so you can visit a doctor virtually, whether it's on your laptop, a tablet, your phone, and it's a licensed doctor, and you would see that doctor for maybe something minor. Let's say a sinus infection or pink eye, something like that, where the doctor can review your case over the phone, over the video, and they can also write prescriptions. So it's a great way for those middle end of the night issues. As a member or as a mom, that's something that's helpful. But as an employer, you might as an employer think, if I can help my employees stay productive, stay well, and stay focused on their job, you could have maybe a private place where they could go and shut the door and do a 10-minute visit versus making an appointment, driving 30 minutes, waiting in the waiting room because the doctor might be running late, incurring a higher cost than maybe an online visit, because most of those online visits are going to average $49.
Yeah, absolutely. I can say, having 2 small children at home, that was my experience. It was something simple.
Right.
It wasn't anything to bring them to the emergency room, but the pediatrician wasn't in the office at that time. I just wanted to get it taken care of, so I didn't have to take off work. And all you have to do is you download the app, you have it on your phone for whenever you might need it. Open it up, and they have a list of the doctors available at that time. You can choose which doctor you'd like. They pop up in a video on your phone. It's like you're FaceTiming with them, and I show them my child, and they take care of it. They can call in prescriptions, and so I can say I am
very well versed.
I am a walking testimonial for Live Health Online. I've also used the nurse line. So, for moms or anyone who's busy and isn't able to always run to the doctor and wait in line, like you said, those are really great tools.
Right.
I don't think a lot of people know they exist.
Right.
So.
And again, that's a great thing for employers to talk to their brokers. If I'm with Anthem, what bells and whistles, what sets Anthem apart from the competition? And those are some of the things I think they should be talking about and promoting to their employees.
Absolutely, absolutely. Well, I think those conversations, is that where they should start, with the broker?
Definitely. I think having a trusted broker that's familiar with the small group market, has experience with employers with 50 or fewer employees is critical to navigating the system. Finding a trusted broker, there's a great resource. If an employer doesn't have a trusted broker, great resources at the Dayton Chamber, and the Dayton Chamber can offer some suggestions on partner brokers. And there's really a great resource in that, because the employer's not paying any additional fees to use the broker, and the broker helps them navigating the quoting, the renewing, the benefits, helps them with if they want to have open enrollment meetings again. Sometimes they'll do those on their own. Sometimes they'll bring the carrier in. Just a great way to make sure the employer is talking about all the benefits that are out there and that they can offer.
Absolutely. I'm going to put you on the spot a little bit and just ask, what would you say is the payoff for an employer to really take some time now and take a look at 2019 and what they can do, not only with their healthcare coverage, but to make their workplace a healthier place to be, and really focus on this for their employees?
Right. So I think, what's the date? The 14th. So I think the time is now. If your benefits renew in January, I think it's, offering benefits, I think, is critical to attracting good talent and keeping good talent and keeping a healthy workforce. So I think, offering health benefits obviously helps accomplish that. I think offering a brand that is well recognized helps offer that as well, with Anthem Blue Cross and Blue Shield. And then, like we talked about, those additional coverages, offering dental, life, vision, and even disability is something that may set a small employer apart, because not every small employer offers a full gamut of benefits. And they can offer those benefits even on a voluntary basis, where the employer doesn't have to pay the cost. They don't have to sponsor maybe a dental plan. It could be a voluntary dental plan, and the employee pays all of the cost of the plan. They could offer benefits in that manner as well. So I think it's just a great way to to set themselves apart from their competition.
Yes, which, as I mentioned earlier, we know at the Chamber that has become something that's very important for employers, because it is a competition out there to attract their skilled talent they're looking for. And so a lot of employees today are looking at, what does that benefit package look like? It's not necessarily just the salary anymore. They're looking at the extra package that comes along with it, and this is a way they can set themselves apart.
Right.
Perfect. Anything else you wanted to mention, Lori, I didn't talk about?
No, I think we did a great job. I think we talked about a lot of different topics today, so thank you.
Yeah, well, I think this is great timing, and hopefully our employers are thinking about this as they plan for the new year. Look at what they are offering, if anything at all, and you mentioned so many options. I think talking to the broker and going over what the options are, what's the best fit, is probably the best approach.
Thank you.
Thank you, Lori. Thanks for being here. Well, if you are interested in exploring health insurance options offered through the Dayton Area Chamber of Commerce, which we talked about some of those today, and Anthem Blue Cross and Blue Shield, just go to DaytonChamber.org, click on Services, and then Member Savings, or you can start with your broker, ask them. And you can stay in touch with the Chamber on Twitter, Facebook, YouTube, and LinkedIn. Give us a like if you're out there. I'm Holly Allen, Director of Marketing and Communications for the Dayton Area Chamber of Commerce. Thanks for being with us today. Stay tuned for a quick message from our President and CEO, Phil Parker.
Healthcare remains one of America's top 2 issues and has been either number 1 or number 2 for the last 6 years. For more than 25 years, our chamber has worked together with insurance provider Anthem Blue Cross Blue Shield, as well as with our local hospitals, in developing and keeping healthcare programs available for our member employers and their employees. The Affordable Care Act made many changes to the healthcare marketplace over the last 8 years, but several things remain constant. First, employees and their families need healthcare services. Second, employers struggle to keep up with the pace and costs for their workers. Finally, employees and their families are using more care, not less, and thus adding to the impacts that drive up costs. Our Endorsed insurance program through Anthem has continued to be creative in providing sound plans, wellness programs, driving quality at all levels, and working with the business community to help employers understand their options. Today's program featuring Anthem gives us an update on the marketplace challenges and opportunities for employer-based programs. If you are unsure of your coverages or opportunities, we encourage employers to reach out to our local insurance brokerage community for help and professional advice. We know how important it is to have insurance in today's world. In addition, our chamber will continue to work each day to provide our member companies with new creative options that are available in our marketplace.